Good day, everyone. Welcome to Radiology Rewired, intelligent workflows for a new era of imaging. Before we begin, let me cover a few conference details. Please note all audio lines will be muted throughout the webinar. We will have a Q&A session following the presentation. To ask a question, please use the Q&A feature located at the bottom of your Zoom window. Today, we are joined by Dr. Anjum Ahmed, Chief Medical Officer at AGFA Healthcare, Dr. Cal Clark, Associate Professor Clinical and Vice Chair of Informatics at UT Health San Antonio, and Dr. Rajeev Nowrangi, Director, Radiology Imaging Informatics at Loma Linda University. At this time, I would now like to hand the call over to our first speaker today, Dr. Ahmed, to cover our agenda. Please go ahead.
Thank you so much for the opportunity today, and we are very excited to be part of this webinar. Dr. Cal and Dr. Nowrangi, I've known them for a while now as a user of AGFA healthcare systems. And when we were looking at, constructing the structure of this webinar and speak today, we looked into what really is going on in the industry, where radiology is today. Coming from AGFA Healthcare and given what we have been doing in this industry, so it is important for us to share also with you what is our vision, what have we learned, why do we believe radiology needs to be rewired and not reinvented, or the innovation, how it needs to be incorporated. I'll open the later half of the session, the majority part of this session, into a discussion with both Dr. Nowrangi and Dr. Clark. And then obviously we'll be taking your questions as well as we move along and go forward this conversation. Now, the thing that really is in the focus of discussion today is, where is radiology today? Is it under extraordinary pressure, or how the technology is helping reinvent some of these innovations that we are seeing in the world of imaging? I'm not talking about enterprise imaging at the moment. I'm talking about the imaging itself. Imaging volumes, as we know, are surging. Scan complexity is rising, because while the expectations in the radiologists have been, productivity, efficiency, deliver on time, but the support systems that they rely on, the workflow tools and, the data accessibility, they are certain times too fragmented, outdated, and I would say unforgiving, because this is where the whole discussion around, from clicks to clarity, how do we bring clarity to the visual experience of these radiologists and the system users? So it's not just that there is a productivity issue, there is a clinical experience challenge as well, because what we believe in at AGFA Healthcare is that when you're enabling or integrating or embedding innovation into your technology and tools, that disjointed workflow challenge that exists in certain scenarios, and we will talk about those, how can we help improve that experience? The time spent in clicking, how should it be replaced into time spent in clinical decision making or interpreting the images? I like to say this because radiologists, I think, are artists. They play with visual intelligence. They interpret that visual intelligence. And as technology solution providers, we need to rethink about how we, improve their experience in terms of how the systems need to be more collaborative. Now, as I say this, it is also important to highlight, where are we coming from? What has AGFA Healthcare learned and implemented as a result of our history of digital innovation? We were the solution provider for so many of our customers as their first PACS system. So that is a journey that we started over 30 years ago. And as we progressed towards the later journey of our product life cycle, we introduced a comprehensive enterprise imaging solution built from the ground up, not a technology stack that was built on certain modular components, but a ground up one consolidated solution with a modular strategy so that our customers could add on and activate some of those use cases as their needs grow. We were also one of the industry leaders in 2015, 2016, when we started working on AI. So while AI in those years, 10 years ago, was more of a theoretical discussion or how it could be implemented, we were working with some of our customers and research institutes to understand the application of artificial intelligence in PACS as it was then, and transitioning towards enterprise imaging. And as we progressed, we have been fortunate because of the feedback that we have been receiving from our intelligent customers, like our panel here, challenging us as well in terms of what we need to develop. So that has also helped us achieve some recognition from industry, platforms such as Class Research. So that is something that we believe gives us even more confidence to continue to build on that experience from our customers. Now, when we think about what we have learned, and as I said, evolution of PACS into enterprise imaging, the goal was consolidation. Because as I said, radiologists are not just imaging readers, they're expert knowledge workers. And they spend more time, instead of spending more time battling with technology as compared to practicing their profession, we wanted a system that doesn't fail them. We wanted a system that helps foster collaboration between multiple imaging or clinical imaging service lines so that the contextual information for that visual intelligence for this patient or the patients that they're looking for enhances their user experience. So that's how we started building our enterprise imaging strategy and building on that system. Now, why AGFA Healthcare platform we think at AGFA Healthcare stands out, and that is a conversation I'll have also with the colleagues here. We think different in different perspective, because if we do not optimize radiology and if we do not enable those technological advancements, it is easy to talk about, improving triage, improving workflow orchestration, and other capabilities with integration of artificial intelligence, for instance. But if the technology stack itself has not advanced with those innovations, it is difficult to deliver on that promise. And that is where there are a few specific aspects of our solution that I wanted to highlight. That we're moving away from the thick lines, as the technology calls them, to more zero footprint access with native viewing, no installs, true mobility. Intelligent workflow orchestration is something that we'll talk about as well. Subspecialty workflows, I've heard from both colleagues here that it is becoming more and more relevant, and how workflow orchestration and automation would improve. AI, as I mentioned, because we had tested and evaluated AI much earlier in our journey of innovation. So we have some areas where we have shown improvements to our customers as well. And then obviously the cloud scalability and the image lifecycle management through vendor neutral archives. We will talk about these points in specific aspects. I wanted to highlight here before I open to the panel that when we say radiology rewired, it's not just about innovation, it's reinvention. Based on the similar topics that I mentioned earlier, is how do we enable automation? How AI enhanced decision making can be embedded, not just integrated at a modality specific level, because we all know there are so many hundreds of AI development and solutions in the market today. So bringing these real world deployment experience into this new operating model that we are trying to develop to help improve sustainable radiology experience, because it should not be just about today, what the future holds with these solutions for our users. Now, as I said, we are very fortunate that we have two very experienced, not only from a clinical perspective, but also the thought leadership that Dr. Clark and Dr. Nowrangi bring into this domain when it comes to enterprise imaging. And I think we should start from where the day-to-day function of a radiology department, or the daily grind, as we may call it. Maybe I can start with a question, and it's not just for Dr. Clark or Dr. Nowrangi here, but for our audience as well. That when if you're a radiologist, think about when was the last time you ended your work day and you thought about, hey, you know what? That was a really focused and efficient day, truly meaningful because I was really focusing on the clinical side of the things instead of worrying about clicks or launching a certain study or exam. I probably may want to start with Dr. Clark here to help us, give your thoughts and perspective on how do you see your routine everyday work and where do you have challenges and where do you see opportunities? Thank you.
Yeah, thanks for that introduction. And just by way of giving perspective, I'm an overnight radiologist in the ER where we interface a lot with clinicians and we're reading, a very large amount of exams. And I think that this kind of like overnight experience is probably where there's the most pressure, the workforce pressure, and where we're seeing the most opportunity for efficiencies. But yeah, so what we're seeing is that there's just an increasing demand for this particular test because radiology is a good test. Um, I think from a kind of like a repetition standpoint, when I'm going through cases, the ability to like how many clicks does it take me to complete a task? How fast can I get to the assessment phase and view comparisons? Because we really have to think about our job is a visual awareness task and a clinical awareness task. And from a visual awareness task, I think that's a technical solution. It's a product solution, and then this clinical awareness, it's like how fast can I understand what is my job here? And I think as we kind of move forward, I think the visual, like what you mentioned with the thin clients, that's being solved. And then this next era of radiology is going to really focus in on this clinical awareness to make sure we're answering the question, because that's really what we hear from clinicians is, hey, you're not answering the question. We were really concerned about this, and you were talking about something else. So I think that's the part where like the burnout is the highest is because I'm trying to do a good job and try to solve the problem. I know how to look at the image, but I'm trying to get on the same page with the clinician, and that's where I have the most frustration.
I absolutely agree because that's where the power of collaborative tools within the system allows you to bring not only, as I'd say, collaboration between the clinical side, but as you said, the visual intelligence. Dr. Naranji, I wanted to pick your thoughts as well on, based on what you do in your day-to-day practice and where do you feel this all fits in?
Yeah, thanks for everything that everyone said so far. It makes a lot of sense. I relate to a lot of that. There is increasing demands, and that's an understatement, not only in volumes, but in complexity, like you said. I'm a pediatric radiologist, so maybe I'm not impacted by the bulk of the volume as much as the adult side is, but I interact with the adult radiologists quite a bit in my role. I also interact with trainees at Loma because we're a teaching hospital, and my big frustration really is in that area because of the friction that exists in the way we interact with images and large data to come to our clinical conclusions takes away a lot of my time from my teaching. And so it not only impacts me, but it impacts my trainees who are being suboptimally trained, if you will, all right, because of a lot of the friction that's present. So I think if we start to consider the big picture where we improve, optimize, where we decrease friction, will allow us to do a lot of additional work as clinicians, not just parts of a big giant machine, if you will.
So the way I think about this is that the burnout question is not a whisper or a hallway conversation anymore. It is something that is openly acknowledged and it is growing. And there is strong desire to have those technology solutions that are able to bridge the gap between the visual and the clinical intelligence. And we have this as one of our discussion points as well, because when you think about these pain points or these challenges, we need to also consider the possibilities, right? What these enterprise imaging solutions bring. And when I think about this from a day-to-day routine workflow or the practice that radiologists are engaged in, how does it resonate? Where do you feel that you had more strain on specific aspect of your clinical work, and how enterprise imaging helped you streamline access to imaging data in one interface, for example, whether you're working on premise or whether you were at home, whether it is real-time access to images or subspecialty, in radiology is also very significant. So something in relation to how you've experienced enterprise imaging help alleviate some of your challenges. Dr. Clark?
Yeah, I think in two respects. So the first one, I don't think AGFA really talks about this that much, but I think when I started off as a trainee, this idea of the comparison ICU neuro CTs, where there's a lot of stuff going on, there's hemorrhage, there's midline shift, and the clinical teams are asking, what's the interval change? And this idea of like 3D registration of the head between the two exams has turned that exam to what was one of my least favorite to I think one of my most favorite, because now it's like I know the head CT is now registered between the two, and so that's just a great between the two, so I can very easily see like is it better, worse, same. And so what took me before a lot of time to be like, oh, I have to mentally make these adjustments, being able to do that in an automated sense is a significant improvement and a lot of reduced fatigue, because I'm not wrong, and number two, I can go home and know that hey, I'm pretty confident in my results. And then I think the second aspect of the fatigue that is probably not solved yet is a persistent area of fatigue is just knowing when I get these exams, sometimes the patients will be kind of like off center, and especially like for like cervical spine CTs, and just trying to kind of use 3D reconstruction tools to reconstruct that spine. So I think these kinds of like stop making my visual experience more difficult than it should be. I think is an area of where we could improve, because our brains are wired to basically be like big AI machines, and we're very good if we're given consistent inputs to then translate that into answers. But the more that we kind of make the inputs more noisy because the patients are off center, because there's an angle adjustment, that just is more and more fatigue, more and more errors. And one area so moving away from the visual science and more towards the administrative and the kind of like the clinical workflows, is that we were kind of having this issue where it's like the clinicians were frustrated because it's like, hey, you're not, we're trying to discharge this patient and you're not reading in the optimal order. And so this idea of kind of like smarter workflows. So what we had implemented was kind of like a color coding scheme. So we gave the enterprise from the managerial aspect of the radiology department access to our work list color coding scheme to say like, oh, color these. If you receive a call or if a patient's about to be discharged, we can create a new tier of priority to say like, hey, read this one first of the stats, read this one because this one is holding up a hospital bed. And so what had turned into these reading room calls could now be kind of ingested and manifested through the actual AGFA work list. And as a radiology fellow back during my training phase, that was always the kind of the dreaded phone call in the morning where we'd get calls from all the clinicians saying like, okay, here's our list, here's the order that we need you to read them on. And so we're like writing this down. It's like this just made no sense. It was crazy. So our ability to kind of provide that ordering user experience and not have to have it overstaffed or to fix an administrative workflow problem with overstaffing is how we kind of deal with this workforce shortage to do more with less.
Wow, because this is exactly, I mean, you have helped us define, the statement here, enterprise imaging as a force multiplier, because this is what we really mean by how we force multiply your clinical capacity, enhance confidence, and restore a sense of control, giving it back to the radiologist. Absolutely agreed. And Dr. Nowrangi, I know you wanted to say, obviously, with your experience as well.
Yeah, so I resonate with everything Dr. Clark is saying. I mean, we struggle with those same things, and AGFA has solutions for those for us. And I'll keep them in broad categories. With the visualization of the images, with hanging protocols, especially AGFA has done really well where we are starting to see more consistent kind of placement of images that makes it easier for the radiologist to kind of get through the case and decrease fatigue ultimately. Then there's also the workflow aspect of it, the triaging, the building out of the workflows. The work list has also really improved, in the way we function, decreased fatigue again at the end of the day when we're not fighting the work list. You just have it there in front of you, and you can click on a study and start your work. And then there's the integration aspect of things, right? AGFA has done great with in the way it's integrated with our other systems to make it easy for us to extract information from different environments. But I would like to highlight actually one of the pieces that doesn't get as much attention in the limelight, I guess, is the level of responsiveness that I receive from AGFA, which is huge. So yes, you have all these tools in front of you that AGFA has built out for us, but to have somebody right there beside you whenever you need it immediately, honestly, to help you with that tool, that's special with AGFA, and I've really appreciated that, and I've built a really strong connection there with AGFA because of that.
That is very so kind of you, and this is what we feel very proud of, the relationships that we have built and the learnings that we acquire as a result with our customers. So this is, and you mentioned, right, the fast access to AGFA resources or the tools, which also then brings me intelligently to how we integrate AI in practice, because it is all about, the right information at the right time with the right data intelligence. Now, as we know today, there are more than 1,000 FDA-cleared AI algorithms, and there are hundreds of AI developers working on those applications, and radiology has been at the forefront with nearly 80% of the FDA-cleared algorithms within imaging and radiology. At AGFA Healthcare, as I mentioned, we started our journey in AI development, evaluation, integration of AI early on, like 10 years ago. And as a result of those learnings, we came up with this strategic approach where we're saying AI is not replacing the radiologist, it is augmenting. So we believe in the concept of augmented intelligence, because we believe AI is all about the intersection of machine learning and advanced applications where clinical knowledge and medical data converge on a common platform. And that is where enterprise imaging comes in, and the Ruby framework that we have developed. Now, while AI, Ruby framework, triage, automated reports, results, embedding all these, we have published case studies as well, which have demonstrated our customers who embarked upon our framework with AI, they have seen significant gains in productivity and efficiency. I wanted to hear from you, and our audience would like to hear from you. What are your takeaways for your own clinical practice in terms of how you've seen AI being implemented, and what guidance do you want to provide to technology providers, and also to the audience, that what do they need to consider, and keep in mind when they're thinking about AI? Dr. Nowrangi, probably I'll start with you.
Yeah, this is a hot topic, obviously, AI, and for good reason, because I think AI is really this tool or construct, I should say, that allows us to interface with giant amounts of data, huge amounts of data, right? That's really what it boils down to. It sits right there in that interface of us humans interacting with large amounts of data. So however you use it, you can use it, to extract information from pixels, from images, where AI can help us focus on findings more quickly, get to those findings, more quickly. Or it can help us with workflow. It can help us on various different stages of the imaging life cycle. I think that's really where I'm excited. We're approaching. It'll be nice to see how we partner up with AI as opposed to use it as a tool where AI can also help augment what we do in a sense where, for example, if I need to have certain settings, if I like to look at my desktop a certain way, my application window a certain way with different profiles, right? Maybe AI can help me with that. Maybe AI can know my profile and add to it, and then I discover quickly that that was really what I was looking for. So those type of things, I think AI can really help boost the way I work and get to my end report, which informs the clinicians to help patients.
Very insightful. Dr. Clark?
Yeah, I think this is really an interesting question because I think that we're kind of in different ages of AI, and I think we're going to see different effects, and I think that it's going to change a little bit over the course of the next few years. So, to put in perspective, I think radiology hasn't really seen the true blossoming of AI for radiologists. And so, to put in that context, we think that the gains from just non-radiology for like ambient listening, for AI documentation of clinical notes in your primary care office visit is around 50% efficiency. We haven't seen that sort of like 50% efficiency in radiology yet, but I think we're going to get there with generative. And by generative, I mean like being able to kind of draft the reports to put that information in. What we've seen so far in the market are a lot of like triage and object detectors, which I think and that's where it's like detecting an abnormality, like detecting the hemorrhage. And what we're seeing with the triage, that it helps. So we're reordering the work list because we're seeing 2 and 3 week wait times to issue a radiology read. But it's not actually reading the list faster. So we're not really seeing that 50% in performance gain that the ambient listening kind of clinical primary care providers are seeing. One thing to kind of keep in mind here is that for this kind of like triage and object detectors, it's not really clear how much time savings exists for the radiologist, because it does create another thing for me to check. It does help me reduce errors, but I don't think that the performance gains are to that 50% yet, 50% level yet. But one thing to keep in mind is that we've really just talked about the importance of radiology AI for radiologists, but I think we're overlooking the importance of radiology AI actually kind of leveling up the rest of the enterprise. So if we're back on the theme of enterprise imaging, the way I think about radiology AI is that the first person that usually looks at the radiology image is not necessarily the radiologist. It can be the clinician. That clinician has never received formalized education in radiology. And we've always talked about like, oh, 2 or 3 wait times to issue a final report. Well, the news is that that patient is not waiting in the waiting room for 2 or 3 weeks. The decision is being made. The clinician is making the judgment, but what are they basing that judgment off of? Sometimes it's just a few kind of sparse courses. It's part of CME. Sometimes it's self study. So I think where enterprise AI can actually help immediately in a lot of these platforms is just allowing clinicians to make decisions about their own patients with some sort of backup via an AI system, or to say like, hey, this aligns with what I thought, what my pretest probability of what I thought was going on with this patient. I'm going to go ahead and act. Or I feel empowered now to contact the radiologist because I thought something serious was going on. The AI says that something serious is going on. Now I'm going to escalate this to the radiologist because now I feel confident. And so yeah, I think that's how the AI systems will play out. And then when we get to the sort of generative reports, we have like internal data that's showing those very similar types of 50% improvement gains with this ability to kind of pre-draft reports, but it's just not there yet, but it's coming. So I think we're going to see the golden age of radiology AI for radiologists come soon.
Oh, absolutely. And it will be, I absolutely agree with you both, because it is where the ownership comes in, right? When radiology is in control, and when radiology guides the implementation and execution of these models, because it's all about data, right? The right kind of data being used for the right kind of intelligence. And I think you said one magic word, which was enterprise AI. And that is exactly what we have tried to achieve with this Ruby strategy, that we've kind of built this framework that allows to help our customers from 3 perspectives. We have created a curated list of best-of-breed AI algorithms that are part of this Ruby package, like intelligence, insight, enterprise imaging. Then there are customers who also approach us and they say, we have a choice of our own third-party algorithms that we want to leverage Ruby strategy on. So we are able to build on that experience that we have developed with this Ruby framework and offer our customers with integration so that they can get the same user experience as well. So this is something that we have also learned over the years. And AI conversation obviously is so huge. Probably Aunt Minnie needs to organize a separate session with us on AI because I want to move forward. And one thing that is really part of this conversation is how do you deliver and display those results? And that's where the power of streaming technology and zero footprint access, as we discussed previously. Because one thing that I feel the last few years have taught to us is that the boundaries of care are changing. Radiologists are no longer, tied to a physical, a particular desktop workstation, or even one facility. They read, they're on call, they across time zones. So, from your clinical perspective, how do you feel this zero footprint access or collaboration between your clinicians and colleagues have helped you while using enterprise imaging? Dr. Nowrangi?
Yeah, it's huge, right? I mean, we've moved on to a point where we have handhelds now, and we keep those in our pockets. We have access to information immediately through large networks and the internet. So if we can do that with radiology, while we can multitask, we can get a lot of work done because there's a lot of demand for it. So I think being able to visualize the data on different platforms in different regions while maintaining security, those are all very important things to us, and I think will ultimately really help us do what we need to do fast.
Absolutely. Absolutely. Dr. Clark?
Yeah, I think the thick clients, the era of shipping boxes back and forth really limited the ability to scale workforce and to troubleshoot and to provide consistent uptime. Because if it's, oh, maybe something's wrong with your install, maybe something's wrong with your computer, or we need to uninstall and reinstall a program, then you start running into just different technical issues. And I think for the zero footprint access and web streaming, these, back to the theme of enterprise imaging, it's like these images are being consumed everywhere across multiple different office rooms. And so the more that we can provide access to the images in a kind of like a stand-up or an ad hoc M&M conference or a tumor board, and not be like, oh, well, hey, did we alert IT that we were going to need to have this thing installed a week ahead of time so they could get it installed in time for the tumor board? That just doesn't make sense anymore. And there's a different level of expectations at this point. So this sort of, when you need it, it's there, is very convenient.
So when I hear you, it just thought comes to mind that we're bringing sense and sensibility with speed and simplicity. So that's
Yeah.
what's happening here with pixel streaming. So thoughtful, so in terms of how your clinical experience. But again, if I think about precision, in workflow design, because we feel that radiologists are transforming how they are working. Too many imaging departments, in terms of specialty reading. Because I'm talking here more specifically about specialized radiology and how workflow orchestration or the role of enterprise imaging as an enabler. So I'll come back to you first, Dr. Clark, because you had some opinions about it when you and I were speaking about this topic.
Yeah, I think the work list orchestration is really interesting because we intuitively, I don't want to read the same case for the same patient over every single one of their chest CTs 5 times in a row. And we know from mammography that that's not kind of standard of care. It's like, hey, you need to kind of alternate to make sure you don't just propagate your own biases and mistakes across the entire patient jacket. And so being able to kind of do that smart assignment to know like, hey, oh, hey, Dr. A read this one last time, so Dr. B should read it this time. That's really powerful, reduces mistakes, is going to just basically be a free lunch in terms of improved patient quality. And then getting to this subspecialists that are targeted for a specific disease process are very hard to recruit. And there's usually not enough of, like, let's just call it a parathyroid subspecialist in the world to kind of read all of the parathyroids. And we want the parathyroid imaging exams to be read by the parathyroid imaging experts. And we don't always have the luxury of being able to narrowly define the ordering exam to like micro target it from a programmatic standpoint. So it would be nice to kind of be able to do that sort of case matching to be like, okay, across our enterprise, this particular radiologist has a very nuanced specialty in their particular discipline. So let's target those exams, maybe the initial exam to kind of set the stage for that patient's course. Maybe the initial exam should be read by that subspecialist, and then subsequent exams, there's not as much of a predilection towards that read. And so I think that sort of workflow orchestration, just doing more with less and being smart about how you're doing the assignments, is going to be very, very interesting. And then the second point I would make is that not every patient needs to be read immediately. And so being able to bring in that clinical context again, so there's not just a clinical, like what symptoms are the patients having, it's like, how fast do I need this result? And so knowing, oh, when is the patient going to be scheduled? Are they scheduled for an office visit same day or in a week? Very different expectations. And from an ordering clinician standpoint, you're not going to get any kind of inbound complaints if you read that that's going to come back in a week, if you read that in 3 days. But what we've done is we've solved that technical problem of not having that intelligence by overstaffing and saying like, oh, well, we've got to hit this artificial turnaround time so that we never have to have that technical capacity. So we need to have a lot more radiologists than we actually need to deliver that clinical care experience, that ordering clinician experience. And so what we're doing is just we're kind of adapting to a new reality, but you need the technical kind of intelligence and the workflow orchestration in order to do it.
Absolutely agreed. And Dr. Nowrangi, you.
Yeah, also agree with everything that's definitely a need that we have as well at Loma Linda. I think what I'll just add to that is from a trainee perspective, there's additional workflows, and orchestration that's required in the way we want to distribute to them before it comes to for the final read. So there's that aspect of it also that needs to be addressed. And then I think, this brings us to data-driven work, right? So having a robust analytic platform where we can see what's really happening, where we can really fine-tune and optimize where studies need to go, who they need to go to at what time, what point. So I think having a robust analytics platform to help us make those decisions will be key.
Absolutely agreed. And embedding those workflow orchestration capabilities throughout the care pathway in terms of the radiology experience of the patient, right? Because that is something that we're not only looking at the native use cases in radiology, but also with the integration of AI, that if AI picked up certain subtle findings, how are you able to triage or orchestrate or distribute those type of findings to the right specialist at the right time, so that they don't need to worry about their own work list. And that's something that really makes it very powerful. Now, in the interest of time, I'll move and talk about what's next, right? How do we continue with the reinvention of enterprise imaging instead of a data repository in terms of becoming more of a system of intelligence? And with all these rollouts that are happening with, whether it is AI-enabled tools that we spoke about, you just mentioned, Dr. Ranji, the stronger analytics, right, for workflow, quality, and even performance assessment when it comes to AI. The support of multimodal data, we believe, is going to be more and more relevant. And then when we talk about platform, we also talk about platformization, meaning this platform should be scalable to address the needs for the future as well, because there is not only imaging data, there is also multimodality data that needs to be incorporated into your tumor board or multidisciplinary team meetings. So as we move towards the conclusion of this session, few takeaways here from your perspective. How do you see this reinvention of enterprise imaging as we move forward?
I guess I can go. So we've been talking about enterprise imaging through this whole conversation, and one of the images that comes to my mind is that story where multiple blind men go and then grab different parts of an elephant and then describe it as something completely different. I think what enterprise imaging is going to allow us to do is to bring and synthesize all of this data out there, right? Not just visual data, but clinical data and all of that, and by leveraging AI to help us extract patterns and really, produce that entire picture of the elephant to the radiologist and to the clinician. I think that's really where we're heading, and AI is really going to help us with that, especially with these generative models that are becoming available now. It's just a very exciting time to be practicing radiology.
Absolutely agreed. Thank you. And Dr. Clark, beyond AI, do you see how do you see the significance of multimodal data like radiology, pathology, uh, probably genomics or radiogenomics in future? Your thoughts on that as well?
I think from a radiogenomics standpoint, I would probably make the argument there that yeah, we want to be able to display in a consistent pattern when we're doing tumor boards to kind of be able to bring in all the experts and work off of a consistent system with all of the integrated data. There's, explorations that are happening and kind of delivering real world evidence into your workflows to say, hey, this is a patient that is on this drug therapy protocol. Like, oh, let me bring up the protocol, or here's the protocol at your fingertips. Because I've always been there where it's like, oh, I didn't know this person was on an anti-angiogenic kind of chemotherapeutic agent when reading a neuro exam, and it's like, oh, I wish I would have known that, or not have to always like go digging in the chart. Um, I think from yeah, I think from being able to see the point of care ultrasounds to understand like, oh, this is why this patient is coming, and I can assist the clinicians on their point of care ultrasounds if they're ingested, to be able to say, like, oh, let me confirm or deny, what you saw. I think that has a lot of intelligence and a lot of potential. But yeah, I think the most important multimodal data that exists is really the text, because that's our kind of interoperability. That's how we communicate in the chart. And so the more that we can kind of extract these really useful tidbits and to really extract the patient story, and kind of I have my monitor set up where they're like the right kind of work list monitor. It's like that part of the monitor is just untapped right now. The ability to kind of put the clinical picture on that monitor to help me very quickly in a few seconds to realize, what's going on. What studies have they already, like what things have they already performed? And maybe, being able to kind of see like, oh, here is the endoscopy, and they saw this lesion. Oh yeah, this lesion is on this image. Being able to be able to quickly make those correlations just brings us so much clinical wealth of clinical information that we're always kind of the super consultant. We were always held out as like the super consultant, but we were kind of detached from the ability to see the data that we were supposed to be the super consultant on. And so the more that we can now kind of open that up via a single repository inside of enterprise imaging, we can become that super consultant again.
Oh, absolutely. And you exactly said how we describe our concept of a life and flow, because this is what we really want to achieve with our vision. An elevated radiology experience that is human-centered, intelligent by design, and connected at every level. Because this is where we will see radiologists spend less time managing systems and more time spent applying their insights into the clinical flow of their day-to-day routine. I cannot thank you enough. This has been a really thought-leading and thought-provoking conversation. And I want to thank Aunt Minnie as well to helping us facilitate this session. Obviously, we want to spend some time with the audience here as well to take your questions and answers for the panelists. Thank you. And we go to the question and answer session now. Absolutely. And this is an exciting follow-up on the Q&A session because we have a global audience here and very excited to see the interactions and the attendance. The first comment that came up is that this session has been amazing and insightful. So thank you for your attendance. I'll build on to the initial comments, Dr. Clark, that you mentioned as well, that how AGFA healthcare has helped with the enterprise imaging strategy, it helped improve with the workflow orchestration and case distribution and management capabilities, right? That instead of hiring new radiologists or adding to the number of radiologists, the system was intelligent enough to help you with the workflow orchestration capabilities. I want to bring this workflow orchestration dynamic into the use of artificial intelligence. And we hear a lot about, from a regulatory perspective as well, certain algorithms are only cleared for triage and notification in the US, whereas in the other parts of the world, they follow different criteria. What do you think? Where do you think AI is going in the next 2 to 3 years in radiology? And how do you see integration of AI versus, I would say, embedding AI into the workflow? Because these are two different things. And that's where I think the audience would be very interested in getting your perspective on the evolution of AI in the next 2 to 3 years in radiology.
Yeah, so I think for AI and radiology, and I think kind of hitting some of the questions that are popping up, we're seeing just a constant expansion of the need for radiologists that are spanning not just your own org, but kind of quickly incorporating them and having this kind of like burst capacity of, hey, like we need to integrate with this third-party radiologist org to help us annihilate a certain type or a certain class of a work list. And so that could be, hey, we're going to keep the cases that we think are fairly straightforward. We're okay with letting those go and kind of tackling those kind of routine tasks. Let's move those out. So maybe that's your kind of traditional outpatient imaging. And then let's keep our kind of like highly technical, our pre-surgical, our post-surgical, our critical kind of exams. Let's keep those in-house because we really want to keep and foster those relationships. So maybe your kind of standard, like, oh, my patient has a headache and they need to have a head CT. We can let that one go. But because it's just like, oh, we just need to clear. They just need an answer. But if it's like, hey, this patient is having a follow-up, they're on a clinical trial, don't let that one go. Keep that one in-house. I think that's the first one. So just kind of like smart targeting, enabling you to kind of have this wider personnel, wider network of radiologists, and how do you kind of pick who receives which study. And then the second piece is just having an awareness of your resources and this kind of just-in-time delivery of the radiology report. So a patient that's in the waiting room, the system should basically know, okay, this patient is in the waiting room. There's no physician that's available to kind of act on that exam. Why prioritize that one? Look, here are the patients that are in a ER bed that need an answer. There's a physician waiting on this result. That should float to the top, so that you're like, okay, here's why the ER is slow is because there's a patient in the bed waiting for an exam. And I've had plenty of times where I've called the result. And it's like, oh, hey, like this patient's in the waiting room. We were just trying to streamline the imaging, but yeah, as soon as this patient's in a bed, we'll take care of this. And it's like, okay, well, that was not good. That was not. I should not have done that. I wish I could have read the one that they're kind of like waiting on my exam, waiting on my results instead of me creating a problem. So I think that's this like workflow orchestration is just, I think, going to be amazing.
Well, absolutely. And that's, I think, one of the questions that came up as well was the role of AI in various ED and RAD workflow settings, right? Whether with and without residents. And this is something that we have been hearing as well in different geographies where certain customers have asked, hide AI results from year 1 and year 2 resident radiologists, right? They're getting trained. Whereas in other situations, we've heard, allow resident radiologists to challenge AI and create a resident work list and let the residents vet the AI results so that when the exams flow to the consultants. On this AI use case, Dr. Nowrangi, your thoughts about how you envision right now versus what do you foresee in the next couple of years with AI integrated into enterprise imaging?
Yeah, so I think it's very difficult to predict what AI is going to do. I think I had my my ideas in the past, but things seem like they've accelerated quite a bit. So it's difficult to predict that. I can tell you what I'd like to see, where I'd like to see AI go, and it's related to what you talked about integration versus embedding the technology. And I think that goes well with a question that was also asked about how do we bring in some of the older age radiologists into this picture, right? And really, I think the answer to that is developing or partnering up with AI in a system that's not integrated, but embedded in a way where it's just where you don't have to interact with it, where you don't where it's not an additional step that you have to kind of learn to do, right? We hope to incorporate it in a way where it's automation without really interacting with it, right? So you just kind of want something and it's there for you, if you will, right? So I know that these type of technologies are being used elsewhere outside of healthcare and outside of radiology, as is in current times. But I think we need to bring that into radiology, and I can see AGFA doing that because it's a comprehensive system of not just the PACS and the viewer and the worklist orchestration, but now we're bringing in AI to sort of drive the entire boat, if you will.
Oh, absolutely. There was another question in regards to, how is AGFA's Ruby strategy going to help integrate other AI models? And we have been very agile and flexible with the approach we have taken with Ruby. It's like a three-pronged strategy where we have a list of curated or Ruby certified AI algorithms that are validated. And then there is the other two aspects are in relation to customers' choice of AI solutions, where customers have said to us, hey, we prefer what you've done with your curated list. Why don't you ensure the same Ruby framework is applicable to our choice of algorithms, a customer's choice of algorithms, which are not on Ruby. So that's where we have come up with the second aspect of our strategy with Ruby integrations based on customer choice of integration, provided those algorithms are standards based and they follow those strategy. The third aspect of the conversation with the Ruby strategy is the emergence of marketplaces and AI platforms. And customers now are asking us, can you follow the same Ruby strategy to help us integrate with the marketplace of our choice? And that is where AGFA's flexibility comes in with this Ruby strategy, is to be able to provide that user experience to customers who have their own specific choice of AI marketplace that they want to work, because trial and evaluation also something comes up. Now, there is one question regarding the current evidence regarding AI performance compared to expert radiologists in detecting pathologies. And this is where the conversation regarding trial, how do you evaluate, what is explainable AI, because there is no industry standard on explainability. Every vendor claims certain, AUC, sensitivity, specificity findings. So Dr. Clark, in your practice, and you had some of these, innovations and implementation of these innovations in your practice. Your thoughts on this?
Yeah, the AI performance. So this is something very near and dear to my heart because I have a high quality and safety focus for my org and just in my own startup, because it's like there is just very like I would say like poor quality control, because our only real way to do quality control is to do you pass your boards, and then we kind of have a peer review system that is not always great, and it's each radiologist is kind of like working off in their own silo, so you don't really know that there's a problem until it becomes a huge problem. So I think to answer the question, the current state of AI is that it performs the best products perform at the equivalent of kind of like your average, above average radiologist. And so then that's great news if you're a above average radiologist because it's like you're still winning. And then if you're a below average radiologist, then you're kind of like, oh, AI is beating me. So it's kind of like everyone because humans are so different, and because the speeds that we read things and the accuracy of how we read things, how we call things differently across different disease processes is so different. It's a moving target for humans, whereas AI is a little bit more consistent. So AI does have that going for it. So it's kind of a complicated answer. Kind of like everyone can win depending on what your perspective is.
Oh, yeah, which brings to another comment that came up in the Q&A box was the ethical risks related to the AI and the analysis of medical images, right? Because from a regulatory perspective, the intended use is usually triage, notification, or clinical decision support. It's not a diagnostic tool. Dr. Nowrangi, your thoughts about, how this, your vision is on this.
Yeah, I try not to focus very much on the accuracy side of things, right? Or the comparison between a radiologist and artificial intelligence. I try to focus more on how can we use artificial intelligence to help augment our work, right? So in terms of like triage, for example, I like that application of AI, which helps us, which draws our attention to important cases earlier so that we can provide that care to the patient earlier. Those are the areas that I really want to focus on with AI. Yes, there's going to be a lot of these other areas where you're comparing a radiologist to an artificial intelligence. I don't know how it's going to ultimately play out. Maybe it's going to be better than us. Maybe it's not. Maybe I think currently as radiologists, we just do a fine job in detecting pathology, right? So I don't really focus on that area very much.
I agree because what we have learned as part of the implementation of AI with enterprise imaging strategy is that if we incorporate the AI analysis or AI in a test environment prior to rollout in clinical environment and train the users on curated data samples that the hospital has, we have seen the adoption and understanding of AI is far more superior and profound as compared to just rolling out AI and then trying to train the end users in terms of AI results. As I said, we're running out of time and the list of questions still keeps on growing. So I would request our Aunt Minnie moderator to help us, with the follow-up on the questions. And obviously this is going to be available as a recording as well. But once again, I wanted to take the opportunity to thank the audience, our excellent panel, Dr. Cal Clark and Dr. Rajeev Nowrangi. You've provided amazing insights for the session today. And I can see that from the comments and the Q&A dialogue that has been popping up as well. I want to thank everyone, the audience, the panelists, and the organizers, as well as Aunt Minnie and our colleagues at AGFA Healthcare, the global audience. And we look forward to hearing from you and receiving your feedback on how did we do in this session and any further feedback in terms of if we missed anything. Thank you so much.
Thank you.
Thank you.